Hello, I've got a big pleasure to talk to you about. Our meeting is related to the upcoming conference, Lung Ultrasound. Please welcome Tudor Toma. Hello.
Yeah, cool. Thank you very much for the invitation. Thank you.
I want to ask you a few questions around the lung ultrasound and maybe what you can say about education in your specialization in medicine. Pneumology. What do you think? It's a big need to educate your colleagues in lung ultrasound?
So I work in London, and I've learned lung ultrasound in London. I'm originally from Romania, but I came to London 20 years ago, so more than 20 years ago. And in London, we started lung ultrasound when there was a report showing that a lot of chest drains are put in different organs other than the lung, like heart, spleen, liver. And that report gave the indication that any chest drain should be put with a chest ultrasound beforehand. So this is where the pressure came to learn chest ultrasound, and this was about maybe 13, 14 years ago when we started. At that time, there was no formal training for chest ultrasound, but very quickly the Royal College of Radiologists in the UK came up with a protocol to train non-radiologists for lung ultrasound. And the training was basically a one-to-one training with a mentor. Okay. I think it's very important to train people, first of all, because you get very useful information for your day-to-day diagnosis. And since that time, we've expanded a lot the use of lung ultrasound. So we're not using it only for pleural effusions. We're using it for everything, basically. And it's becoming more and more part of the routine clinical examination. So lung ultrasound gives you an objective finding, which it is 100% or present or absent. Yeah, so like a little bit of pleural effusion, you will see it 100% with lung ultrasound. That changes a lot the way you analyze the information to reach the diagnosis. So I think it's very important to train and to use it.
Okay, great. I agree in 100% with you. And what you can say about the first steps? What do you think that time when you're learning this examination? What do you think about that?
The way we train our junior doctors is to go through a very basic course, a presentation of how to do it. We simplified the process into three main areas or elements: knobology, image acquisition, image interpretation. And then we have these practical sessions either on simulators or most of the time on patients, because it's not invasive, and with supervision they start doing it. And the practical training is basically what we call a non-touch training, where the instructor or the senior person is not touching the probe ever, is the trainee who is always with the probe in hand.
Okay. So do you think you've got this great skill? You can perform lung ultrasound. You think you are one step forward every day in clinical practice?
I think I have excellent lung ultrasound skills. I'm joking. I think we are actually learning every day, and my interest is to expand the use of point-of-care ultrasound, not necessarily lung ultrasound. So, for example, I thought I expanded quite a lot until recently. One of my anesthetist told me that you can do eye ultrasound. So ultrasound the eye to look for signs of brain edema and hypertension. So you know, every day with every patient we learn something, and I think collaboration and also this kind of network, and that's why I'm very pleased and honored to be invited to link with you guys, is we learn from each other all the time. So I think this networking is really important, and probably nobody has the whole knowledge. We all have some special interests and maybe some special exposures, and therefore we can learn a lot from each other.
Okay. So thank you so much for this meeting, and we can invite just only upcoming this conference, Lung Ultrasound, in June this year, and you can all of you can hear and watch the presentation all around the world, and some only practitioners, lots of people who every day grab the probe and do the examination. So thank you very much, and have a nice day.